Hey everyone, it is January 21st, 2021. I have not done a YouTube video probably since I was high fat, mostly plant-based at that time, protocol. So any videos that you have come across, that's pretty much what they were about. So I'm going to talk about my journey. It has nothing to do with nutrition at this point. There will be nutritional points involved with the situation, but that's not the point of the video. The point of the video is I want to do this video as part one of a few videos that will be coming up to share my experience with cervical dysplasia CIN 1, 2, and 3, squamous cell, HPV 16 and 18, which those are the two HPV viruses that are known to cause cervical cancer. All right, so I'm gonna do my best to get through this video and get it done because I wanted to start doing these and get them done. You're not gonna get any fancy frou-frou bullshit. I'm not like one person to get all fancy in front of the video. I usually try to do it in the moment while I'm thinking about it. To get these thoughts, I did write some information down. I had to go back and look at my pathology reports over the last 3 years and kind of write some information down, some bullet points, just so I didn't forget with this video. Yeah, so you can see my Christmas tree is up. I took all the ornaments off, and she was a fresh tree, so I didn't want to take her down just yet. I can still smell the pine. She's got some new growth, so that's just a note on the Christmas tree in the background. So we are at January 21st, 2021. We're still dealing with COVID here, so I'm going to note that as well. And I'm going to start this video, and I will probably descript it as that. It's my journey with cervical dysplasia, CIN 1, 2, and 3, ascus, HPV, all of those are all kind of combined. And I'm going to go into major specific details, but you can look those up. Cervical dysplasia, CIN 1, CIN 2, CIN 3, ascus, abnormal pap smears, things like that. So April, we're going to go back to April 2013. I had my son Liam via C-section. I think probably a year later I had a pap smear. In April 2017, I had a severe bladder infection. So I didn't have all my post-op stuff, and I don't think I recalled in my information that I had a pap smear anytime after that. But in April of 2017, so 2013 I had Liam, 2017 I had a severe bladder infection. And if you don't know anything about viruses or HPV in general, you could have HPV dormant for many, many, many years, and you could have a triggering effect like a severe infection or major stress or a catastrophic event or catastrophic disease. Something like that can trigger these viruses. Now, yes, your body can fight these viruses off, and you can be reinfected and things like that. But it is a virus, and your body can fight it off. But if you're also trying to fight off, stress or severe infection or injury or anything like that, that could be a problem. So in April of 2017, I had a severe bladder infection that put me in the ER. I could not naturally take care of it myself. I had to get assistance, and I always say I would do everything as naturopathic as possible. I don't use pain medications. I didn't use Tylenol, ibuprofen. I didn't use any of that. Ended up with a fever I could not break. Fevers aren't bad, guys. They're really not, but it was a fever I suffered with for a few days, and it was causing some other problems. So in 2017, I had a multitude of testing done because I was refusing narcotics. I was refusing left and right. I was probably deemed a difficult patient, and maybe some docs at this point still may deem me as a difficult patient. I'm just a patient who advocates for herself and does not jump to the first thing that the doctor is suggesting. I always try to find a path that if I can naturally do it, I'm going to start there first. If I cannot, then I will look down the traditional Western aspect. I try to practice more Eastern medicines as much as herbs, tonics, homeopathics, essential oils, things like that, etc. So I fought it and I fought it, and I ended up having to take antibiotics, of course, because it was a severe bladder infection or urinary infection. You don't want to have that cause kidney problems and damage. That's bad. So antibiotics is not good. So Fast forward to September 2017, so April 2017 severe bladder infection. Is September of 2017, I had my pap smear. Hadn't gone in, I don't think, at that point in a long time, because I really haven't had any problems. At that time, I had atypical squamous cells. HPV DNA was negative. So at that time, it was a normal pap smear, from the way I read the pathology and from what I can remember. Again, so I try to do things in the moment instead of later on, because sometimes it's hard to differentiate the medical terminology on these pathology reports. 2018. So less than 6 months later, I had another severe bladder infection. Again, one I tried to fight myself. I had severe fever. Again, ended up in urgent care this time instead of ER, and succumbed to another round of antibiotics within a 6-month period, which is not good. Basically, it's napalm in the gut. It kills not only the bad bacteria, but the good bacteria. So there's a lot of healing. And at this time, I'm still trying to do a high-fat protocol. I had just started a high-fat protocol somewhere in there to help with healing. I was vegan for 7 years, plant-based, and when I mean vegan, it was clean vegan. I mean, I didn't do a lot of processed vegan foods or junk foods and things like that. I'm not saying I didn't have that stuff in there, but it was more of a cleaner, whole foods-based type of approach. And then I came into the keto-ish camp, and I am an experimenter, so I like to experiment with my nutritional protocols as well as other alternatives. And so in this time frame that this happened, I had a severe bladder infection. Fast forward to April 2018, so a couple months later, I went in for another pap smear, and it was ASCUS high-risk HPV cervical. HPV, so it's that 16 and 18 DNA sequence that is known to cause cervical cancer. At that time, I think she just wanted to do a repeat pap, and so I had the repeat pap in December of 2018, and that came back ASCUS HPV moderate squamous cell dysplasia. So in that time frame, if I remember correctly, because there were some homeopathic deals made, which means she wanted to do a colposcopy, I think after the April results, because it was high risk HPV, she wanted to do a colposcopy, which is a deeper type of a biopsy on those cells of the cervix. Again, if you want some more information, there's tons of information, YouTube videos out there. I'm not going to link anything. It's just a lot. I'm just going to share you my story. If I feel like I want to add other things to the video down the road, I will, but this is just the start of the journey of information of where I'm at, where I was to where I'm at now. So we made a deal that I decided to do some research, and I found some naturopathic, homeopathic ways to try and treat this virus with tinctures, herbs, essential oil, suppositories, which are inserted into the vagina, using tampons to keep the coconut. It was basically coconut oil and essential oil mixture that was frozen. So it was basically vaginal suppositories that I would do for this period between April and October. With that, it did come back ASCUS HPV still, but it was moderate dysplasia, so it had decreased a little bit from high risk to moderate risk. So there was a bit of a help on that. So I had the colposcopy, and so let's see, that was October 25th, 2018, where I had the squamous cell, moderate squamous cell dysplasia. Previously, it was high risk HPV cervical ASCUS. So in April 5th, actually Liam's birthday, 2019, I had the colposcopy done. I finally said, okay, I gave it a try. It's still not decreasing what we want to. So we did the colposcopy, and that showed that what I had been doing, so the pap smear said one thing, and the colposcopy, which is a deeper biopsy, came back CIN1, which is low-grade cervical dysplasia, which means just follow up with a pap. So that's glorious. I didn't have to have another colposcopy. So that means that at some point the homeopathic remedy that I was doing was working. Like me, I didn't continue that. I stopped it. Summer kind of got away with me because that was April 2019. I started, getting to riding, cycling, road biking, long distance road biking the previous year. So April, May, June, July, August, September, you know, I get into road biking and traveling and then things like that. So it kind of got away from me doing this homeopathic protocol that I was following that reduced my dysplasia from high risk to low risk. And it bit me in the ass, and stress and all these other things that then could compound. So I had the pap smear, and that was December 2019, and it was still showing low grade to moderate, which is CIN 1, CIN 2. So basically she's like, all right, we need to do another colposcopy, and I didn't really fight her on this one. I did treat it on my own a little bit and set the colposcopy up, and that was sorry guys, March of 2020. When I had that colposcopy done in March of 2020, it came back CIN 3. So again, I decreased it to CIN 1, and then it shot right back up to CIN 3. So we went from low grade to high grade pretty quickly within 3 months, about a 3-month period. High grade cervical dysplasia, and again, precancer cells is pretty much layman's terms, is precancer cells. You leave it, you're going to get cervical cancer. And so I continue to, like, when I do homeopathic remedies and things like that, I don't, you know, depending on how intense they are, and they were pretty intense for a long period of time and slightly inconvenient, but I've always done herbs and herbal tonics and remedies and essential oils and different things like that. So in eating whole, real food mostly. Again, I was experimenting eating more animal products in this period of time as well, eating, you know, more processed foods while I was on the road bike. With our trips, there was, you know, less access to high quality food, so I let things slip a little, and so that probably didn't help the situation at all, as if I were to be 100% regimented with the situation. If I was hardcore nose to the grindstone, it probably wouldn't have gotten so out of control so fast. But again, you start cutting cells, you start dissecting cells and biopsying cells, we know that can make those cells grow and spread. That's not an unknown situation. We know if we cut cancer, sometimes it can spread. Even when we think that's like when docs are doing biopsies, if they can't get it all, it's very easily that those cells can spread and grow. That's not uncommon at all. So March 2020, high grade, CIN 3, came back, and this was the month after I got back from, my boyfriend and I got back from Arizona. Sorry, I'm having these lapses. From Arizona, we went and did a Spartan race. We spent a week and a half, almost 2 weeks out in Sedona and Phoenix, and we did a ton of hiking. Again, body was under stress and things like that. Environmental things, there's just a lot of things that were in factor. With February, COVID was just creeping its ass into our area, and actually creeping into the area we were in. I don't think, oh, and I want to note this because I didn't write this down. December 2019, I had the pap smear at the same time that I was also extremely sick because I had been overtraining for this trip that was in February 2020. My son had severe infections. He had pink eye, conjunctivitis. I ended up getting pink eye and conjunctivitis. My body was severely overtrained. It was underfed, and not purposely cutting for any reasons, just overtraining, got sick, went back to training for this vacation. So there was a lot of stress that took place when she did this pap smear in 2019, where everything just kind of shot up. And again, your body has events that can cause other viruses to erupt, show themselves, or explode. So March of 2020, that's when it showed high grade. We're getting really concerned at this point. It's CIN 3. It's severe dysplasia now. We are not moderate, we're at severe cervical dysplasia, squamish cell, CIN 3, okay? So March 2020, again, COVID hit, right? COVID hit in March. COVID hit in March, shortly after I think I went and had this test done. And they're like, you need to come in for a colposcopy. We need to do another biopsy. We need to see what's going on. So mild to moderate severe dysplasia, CIN 3. So it's really nothing has changed. It's just either staying the same or getting worse, gradually getting worse. All right, so That was June 2020. So I also want to note in here too, along with all these pap smears and biopsies, colposcopy, which is a biopsy, it's just a deeper biopsy in the office. May, June, and July, and I'm not sure of August, I started having major issues. I'm 44 now. I was having major issues around my ovulatory time. And previously, dial it back a little bit, I apologize for being a little kind of back and forth. That happens sometimes with me. I apologize. In January of 2019, I had to recover my period. So there was a period of time between 2018 and 2019 where I went 6 months without a period. Again, overtraining, not eating enough, stress. So I had to do things to recover my period. And that basically means quit doing a high-fat protocol, low carbs, things like that. I had to start increasing the carbs. I had to increase the right types of carbs at the right time, start eating to recover my period. So that played into factor in 2019. So in 2020, in the summer, I was having a lot of ovulatory issues. Like when I would ovulate, there was severe ovulation pain, pelvic pain, bloating. I have an anteverted uterus. I don't know how long that's been like that, if it's been like that since I've had Liam, if I've always had that. So I've always had extra issues with the bladder and colon, typically around ovulation and around my period, or just in general for the years. Like over the years, I've had 2 C-sections, so there's not uncommon for scar tissues and adhesions. My first C-section was extremely traumatic, but so all these things can play into factors. So in the summer of 2020, last year, every time I would ride my bike any amount of distance where I was around the ovulatory, I was in extreme pain for 3 to 4 days. Like, this is worse than period pain. Like, I never really had severe period issues. You know, I did early on because I was eating the wrong things. I wasn't doing the right stuff. But definitely in the past, I would say 15 to 20 years, they've been pretty standard, pretty on time, except for when I lost it in 2018 to 2019. So So August of 2020, so last August, I ended up having to go to the doctor emergency. I'm like, this is so painful. You know, I don't take Tylenol, I don't take ibuprofen, I don't do it. If the homeopathics aren't working, I went in and she did palpitations. She ended up ordering an ultrasound that day. Come to find out, you know, I didn't know if a cyst had ruptured because I knew in the past I had Nabathian cysts, which are relatable to scar tissue adhesion type cysts. I've had family members that have had cyst bursts, so I thought maybe a cyst burst, and that may be still what did happen because it was so severe, but they didn't see it at the time because basically once a cyst bursts, you don't really see all the fluid necessarily. So that report came back basically, yes, describing that I did have some cysts. It also noted fibroids, 2 to 3 inch fibroids, a couple of measurable ones, and then in the pathology report it also stated multiple fibroids, which is not a common, again, in women. Fibroids are not uncommon. And again, my nutritional protocol is always changing and evolving. I'm always experimenting with different nutritional protocols. So different things could have triggered this at this point. You know, experimenting with dairy or eggs or anything that can cause more inflammation in the body or increase of estrogen from the outside in, more soy products, things like that. I don't know the answer to that because I just don't know the answer to that. So I found out that time I had cysts, and then I had multiple fibroids in the uterus. So that kind of made sense with some of maybe the extra pelvic pain and pressure and bloating that I would feel more so than I had before. I have always had that, but this might be just more so. So at that time for my last PAPS, or my last colposcopy, we had decided that we were going to finally just take care of the the severe cells, which basically means outpatient surgery for a LEEP, which is a loop excision. I can't can't remember the exact terms, but it's a LEEP procedure. But basically she takes a tool and she cuts the cells off and to a degree of the cervix, and then they're sent off again for pathology. So that happened September 2020, just this past September, during COVID and everything. I haven't had COVID. That's good, knock on wood. So, and so we did that procedure. I went in for my 4-week post-op, so that procedure was basically, I feel pretty lucky. It was the first time going under general anesthesia. You know, with my C-section, I had 2 spinals, so this is my first time under general anesthesia. I was really scared, nervous to have to do that. It is outpatient, so I was able to go home that day. And the procedure itself, there was, again, some restrictions: no lifting over 8 to 10 pounds for 4 weeks, no sexual intercourse for 4 weeks. You're going to have discharge for almost the 4 weeks, etc. Those types of basic things when it comes along with having a LEEP procedure. Anyways, I go in for my post-op appointment, and I find out that the pathology report said that she couldn't get it all, because she said she'd had trouble over the years with my cervix being tilted, I think because the cervix is at the end of your uterus, and because my cervix is anteverted, she had trouble getting into the canal to get a really good biopsy. So even when she did the LEEP procedure, she did her best with the tools that she had, and she couldn't get it all. Like, it's still, you know, the pathology report said this, you know, we didn't get it all type of thing. So she said, I recommend that you have another LEEP procedure, and this time we use what's called a cone knife conization. So she basically cuts a cone shape in the cervix to try and remove all of those precancerous cancer cells. Again, this was outpatient surgery. I was definitely a little more nervous again. General anesthesia. I had to do it by myself because my boyfriend couldn't go in with me. I couldn't have any support system. He was there, but he wasn't in the hospital with me. He had to wait in the car because of COVID. So I had this procedure done, followed up with her, got the pathology report in my chart pretty quickly, and was reading it, and then there was a revision to it, and I'm like, that sounds like what I think it sounds like, but I wasn't sure. I wanted to talk to her first. And the thought process was true, that basically we're at our limits at this point. And she said possibly when I went in for my last LEEP procedure that the next step would be to potentially offer me a hysterectomy, you know, because I had my tubes tied in 2013. You know, there's no chance of me wanting to have babies or anything like that. But having that as a potential and then actually hearing it are 2 different things. So I had that post-op appointment, and she basically said, we have 2 options. I offer you a complete vaginal, she said vaginal, but we can't do vaginal because of the scar tissue. So I'm going to offer you a complete abdominal hysterectomy, or in 3 months, we can do a dilated type of a colposcopy. So she would dilate my cervix so she could get to my cervix in office, but that couldn't be done for 3 months. And then at that point, we still could be at the point of having a hysterectomy. And I'm like, well, you know what? I don't want to wait 3 months. I've been playing around with this long enough and trying to do things the right way long enough. And she's done everything she could to take care of this, and we were just at this point. And so I made the decision 5 weeks ago, 4 weeks, it was about 5 weeks ago when I had my post-op, that I'm going to have a complete abdominal hysterectomy, which basically means that she's going to remove my fallopian tubes, my entire uterus with cervix. There shouldn't be anything problematic with my vaginal wall or opening or vaginal canal. There we go, vaginal canal. And I should be able to keep my ovaries. and which is a good thing because I'm in perimenopause. I've been having perimenopausal symptoms for a long time now. I joke around, like with a lot of women between 35 and 40, they started to slowly increase, and then 40 to 44, which is now, they've just like increased more and more. And the more issues I've had in the past year or so with the fibroids, I just don't know if there's something's going on. Something's going on. There's a lot more issues. And so I said, let's do that. So they wanted to schedule it in 2 weeks at that time, but I couldn't do that. I've been homeschooling because of COVID. My son does ABA therapy. He's high functioning, autistic, amazing, tiny person. So we do homeschooling. We've been doing that. And so I had to make sure I had people in place because I'm his primary caregiver during the week. He does go to his dad's on the weekends, but I do a lot of the driving back and forth. I'm the one that handles the homeschooling currently. His dad does kind of the catch-up stuff on the weekend. So we decided that that's what I, had decided versus waiting 3 months, having this, and then potentially still having that, and that would put me out for the whole summer. And I'm like, I want to be able to enjoy my summer. I would just go crazy in the summer versus having to recover right now, because it's going to be a 6 to 8 week recovery on the front end and then a 3 to 6 month on the back end or longer recovering. I will try to be updated with these videos for YouTube. I'm not great at it. I try to take the time, and then sometimes I'm just so exhausted mentally, physically, or emotionally, or all of the above, that I just have a hard time sitting down and having a conversation. I do some live videos on Facebook. I haven't really done any live informational stuff on Instagram in a while, so I thought I would just do a YouTube video and put that out there, and maybe I can help, because we do research. If you're proactive, you do research, whether it's the scary information medical sites that give you the straight up legit, this is how it works, or you get people's personal stories, which I personally like both. It's good to have both information. I've gotten a lot of information. It's helped triggered some thoughts and questions that I'm going to ask the doctor during my pre-op appointment, which is great. Some ideas on stuff that I might need to want to have, that I've already got like some planning ahead. And I'll do a video on what I'm doing to prepare for surgery. I will probably do some videos during or post-op during surgery, depending on how I feel, or so on and so forth. So I'm scheduled for a complete abdominal hysterectomy February 26th. So in 5 weeks. So there's some prep that's going in there. There'll be some medical prep that will take place the day before. But then there'll be also some personal prep that I'll be doing on January 2nd of this year. I decided to I always go back and forth. I eat a lot of plants. I go back and forth. Been doing a whole food plant-based nutritional protocol. With this round, I did grass-fed butter in a bone broth protein. So the 2 animal products I did have during this plant-based section here, just to kind of give my digestive system a break and a reset, which is a good thing since I have to have another extremely major surgery, just to kind of get my body prepared in a healthy state as much as possible going into surgery. Preparing ideas of what I'm going to do post-surgery, the day or 2 or 3 after, to help speed up that recovery. I know about detox. I know how to clear the system of drugs, how to help the body when it's been bombarded with antibiotics, etc. And I'll share all that information in another video, because I could just talk about that forever. So that'll take place in complete, again, ovary stay, and so the uterus will go, fallopian tubes, and cervix will go. I'll keep you guys updated. Like I said, I hadn't posted a video on YouTube in a long time, so I just wanted to share with you kind of where it started, kind of give you some bullet points on the dates. So that's basically, like I said, in 2017, I had that severe infection. I ended up having a pap smear that fall in September, and that basically kind of started showing the HPV 16 and 18 DNA sequencing, and again the going back and forth between CIN 1, CIN 2, CIN 3. squamous cell severe cervical dysplasia at this point, basically precancerous and/or, I don't know if technically if it is the low-grade cancer at this point. So it's about a 3-year journey. So, you know, by the time I have everything done, it'll be April. So my post-op appointment is actually scheduled a few days after my son's 8th birthday. So it'll be 8 years since his birth. But 3 years since things started to kind of show up, just under 3 years where things started to show up. And between my homeopathic protocol and her attempts at removing and biopsying things, this is where we're at. So I'm hoping for good results, no complications or anything like that. With any surgery, you have multiple chances of complications. Typical ones are infection, bleeding, clots. Yeah, I would say those would be the top 3. Pain is just going to be there. Also, I'm going to use different things for pain. I will probably, in the front end, we'll see. I have a hard time remembering with my C-section, I was not on pain meds very long. And any anti-inflammatics like Motrin 800 or Tylenol or anything, that was on that for very long afterwards. But again, I know a lot more now, almost 8 years later, than to help with that. I have different CBDs, THC, homeopathics, and again, I prefer to use alternatives versus narcotics as much as possible. I'm not saying I'm not going to use those things in the beginning, because that's what's that, and but this is just a path and a journey, and I'm just sharing my story with you. I'm 44 years old. I'm a female, of course. I'm a mother of 2. I have a 22, almost 23-year-old daughter. I have a 7, almost 8-year-old son. I am dealing with severe cervical dysplasia, HPV, precancer, cancer, going to be having a complete abdominal hysterectomy. Definitely not uncommon, but not talked a lot about in, you know, a few videos I have seen, like they were from years ago, not current. I have found some current stuff. Very good videos, very good YouTubers, very good vloggers. I'm not a big vlogger, so I'm not an editor. I won't edit any of my videos, so if there's any hiccups or rambling, it's all real, it's legit, there's no bullshit, it's just, there's no retakes or remakes. This is just what it is, and this is who I am. And this is where I am at in my journey in life during COVID. So I hope some of you ladies that are younger, if you're going through this, definitely not uncommon in my family. A lot of family members have dealt with fibroids, cysts, endometriosis, severe endometriosis, a lot of female problems. I think I'm more aware of ovarian, uterine, and cervical type issues more. So I think we don't have a lot of breast cancers in the family. It's more the organs that I'm aware of. But again, it's not talked about, so I don't know. A few family members, my mother being one of them, she had her hysterectomy after suffering with severe endometriosis for at least, I think it was 10 years or more, at 32. So she again kept her ovaries, so she wasn't thrown into menopause at that time. I, again, in perimenopause, so there's more of a chance of me going into premenopause or menopause sooner because I'm closer to that window. Again, looking at information, again, your uterus is the organ that supplies the blood to the ovaries. So the ovaries could continue to work as they normally would, producing estrogen and progesterone, or they could slowly shut down a little faster than they normally would have. So typically they say between 45 and 55, and usually about 55 the ovaries have done their job, but that's not always necessarily the case for every woman. Every woman is different, every situation is different, every journey is different. So I feel pretty lucky that I've gotten this far. My sister, again, is at the point where she probably should have a hysterectomy as well. But again, everyone's choice in life, you know, you have to be able to have a support system to be able to do that. I have to have support. Again, I don't have a lot of help, so I have to make sure I line my ducks up to be able to get the help that I'm going to need for a couple of weeks, because I will be not doing a whole lot. You know, Liam needs a lot of attention. He's very active, so he'll have to be with his dad. His dad has to juggle work with homeschooling. There's just a lot of stuff that needs to be put into place for this to be able to take place. I'm young, I'm healthy, I take care of myself, I'm smart, I don't know it all. Again, this is going to be a process and an experience, and we're just going to hope for the best. And I will continue to share my journey with you guys. I will do another video about the prep. We'll talk about fitness prep prior. Any post-op hysterectomy stuff I'll share afterwards, because that'll be a journey and a process on that. But I'm definitely going to share some information on how I'm going to prep myself in the next 5 weeks. I've already been doing it, but what I'm doing to prepare myself nutritionally, physically prepare myself to get ready for this extensive major surgery. Major surgery. This is major surgery. It's no joke. So I will talk to you guys later. Hopefully this has been informational for some of you guys. Again, I apologize if I'm a little rambly. Hopefully you guys made it through the entire video. I'm trying to keep the videos at least 30 minutes or shorter. This one made it about 35 minutes. I hope everyone's doing good. It has been a wretched 2020. 2021 hasn't started out the best for some of us, but that's okay. I'm going to say this now, and I'm going to try to say it without without crying, because this has been an emotional roller coaster. It's a lot of processing emotionally, physically, and there's times in life, even with, you know, there's times in life where we feel like when things are shit up, that you feel like this is gonna last forever, but it's not. It's just for this moment. So we just have to go through things, and sometimes those moments last minutes, hours, days, weeks, sometimes months. But it's just the moment. It's not going to be like that forever. So just try to keep that in mind, that things can suck sometimes, and life can suck sometimes, and it's hard, and it's just makes you stronger. I really do believe that. Just remember that this isn't going to last forever. This moment isn't going to last forever, and you'll be a stronger, better, healthier person on the backside of it. There's always room for growth. There's always room for improvement. I'm always trying to grow and change and gain knowledge. Again, I don't know it all. I just know what I know. I know what I've been through, and I've been through a lot. And if I allowed my life to dictate, I'd be a miserable person. If I allowed to focus on all the negative things that have happened in my life, and all of the trauma and all of that, I'm not going to go into details, but if I allowed that, I'd be a terrible person. But I don't. I try to just kind of work through it and feel it, and then move on, and try not to focus on it, and look. And I always try to, not always, I always try to look at the better part of the day. But there's times where I need other people in my life. I don't have a lot. I don't have a huge support system, but my little tribe always reminds me once in a while of these things that I remind other people of, because of being a personal trainer, a group fitness instructor, a health and wellness coach, all of that encompassing holistic practitioner with, you know, fitness and nutrition and things like that. I just try to do my best, but again, sometimes I need a little reminder too. So I hope you guys have an amazing day.